Hello, good morning, everybody, and welcome. Thank you very much for joining us here at Mental Health Reform for our pre-budget submission for Budget 2026. We're very glad that you could be with us. So we've started, some more attendees will be coming in, but please allow me to introduce myself. My name is Stephen. I'm the Communications and Membership Officer, and I'll be the host for the next hour. So why are we here? Pay the Bill is our national call for urgent investment in mental health in Ireland. Behind this campaign is a very simple truth that Ireland cannot afford to shortchange mental health any longer. Services are stretched, people are waiting, and lives are at stake. Together we can raise our collective voice to stand together and to call for real change. So with that in mind, I'll give you a little overview of what the next hour will look like. Our Policy and Advocacy Coordinator, Lisa Marie, will take a deep dive into the facts that drive our call for investment. Following this, my colleague, Dr. Louise Rooney, who's our Policy and Research Manager, will moderate a panel discussion where you'll hear from our speakers about the real lived experience and what investment can mean for people facing mental health difficulties. So of those speakers joining us, we have Kerry Cuskley, who is CEO of Exchange House Ireland National Traveller Service. They provide frontline and support services since 1980. Emma Griffin's also here, who is a lived experience and mental health advocate. And then my colleague Julia Camara, who is our Innovation Programme Coordinator, will share on her contribution leading the delivery of our Children and Young Persons Mental Health Project, which focuses on early intervention. So you're all welcome here today. Thank you. If you have a question at all, if anything comes up in the presentation or through the discussion, then I would ask you to please use the Q&A function, which you should be able to see at the bottom of the screen. A conversation like this is only as strong as the voices in the room, so I really actively encourage you to share your thoughts and opinions and perspectives on what we're discussing here today and what you feel needs to change in the upcoming budget. This will then create a space after the discussion for us to look to those questions and really get in an engaging group discussion. So at this point, I was to introduce our chairperson, Dr. Judith Malone, to welcome you to this webinar and share her thoughts. Unfortunately, due to circumstances outside of our control, she's unable to attend this morning. She sends her sincere apologies, but she did send me her notes and asked me to speak her words on her behalf. So I'll do my best now, but she would have delivered with a lot more gravitas. So good morning, everybody. Thank you for being here today. It is both a privilege and a responsibility to open this conversation on behalf of mental health reform as we launch our Pay the Bill campaign. I want to begin with a simple truth. Mental health is not a luxury, it is a right. Yet in Ireland today, far too many people still experience mental health support as a privilege that they cannot access, or as a system that cannot meet them when they are most at need. We cannot continue to accept this as normal. We know the figures, but behind every statistic is a story of a person waiting months for an appointment, a child in distress turned away by CAMHS, a family left without hope because the service simply wasn't there when they reached out. These are not abstract challenges, these are urgent human realities today. Our campaign name, Pay the Bill, is deliberate. For far too long, Ireland has fallen short in meeting the mental health needs of its people. Promises have been made, yet the gap between mental health need and services remains wide. Today, we are clearly saying it's time to close this gap. To do that, we must invest, not in piecemeal short-term fixes, but in accessible, effective, innovative, and inclusive services. Accessible so that geography or income no longer determine who gets care and who does not. Effective so that every euro spent results in meaningful, measurable improvements in people's lives. Innovative because Ireland deserves services that are not stuck in the past, but are equipped for the future, harnessing new approaches, new technologies, and new models of care. And inclusive because mental health is not just about treatment, it's about dignity, equality, and ensuring that every person, no matter their background, identity, or circumstance, can find a place of safety and support. This upcoming budget is a test of priorities. If we are serious about parity between mental health and physical health, then that commitment must be reflected in investment. Not symbolic gestures, not token increases, but funding that transforms how we support people. We are calling on the government to act with courage and with urgency. The question is not whether Ireland can afford to invest in mental health. The question is if we can afford not to. On behalf of mental health reform, I urge our leaders to listen, to act, and to pay that bill that is long overdue. So thank you very much. And with that, we can start. I'll pass over to Lisa Marie, who will give our presentation. Over to you, Lisa Marie. Thank you very much. And you're on mute.
Good catch. Thanks a million. It gave me time anyway to get my slides in order. Hopefully they're coming up for you there. So thank you, Stephen, for those remarks, and I think that set the tone nicely for my presentation now, which really, you know, is going to talk through our PBS in a bit more detail. So I will jump to the next slide. So as you can see there, in terms of our call, Mental Health Reform, together with our 83 member organisations, are calling on the government to invest an additional 200 million in mental health services for budget 2026. We want an additional 80 million for the maintenance of existing services, and then we're asking as well for 120 million, additional 120 million for the development of services to address unmet needs. And we see this as urgent in terms of getting us properly on the path to, as Stephen rightly mentioned, given mental health parity of esteem with other health. And, you know, again, when I just want to emphasize, when we look at these figures, obviously the figures are important, but behind all of those figures is a person, is an individual. They are our families, they are our friends, and they are us, and we deserve better mental health services than we currently have. So just, I suppose, I thought it would be useful to point us on the path to 10% of the health budget by 2030. So as many of you will be aware, it's the Sláinte Care target that we get to 10% of the health budget, and it is urgent that we do so. And ideally, of course, if the government you know, decides to give more earlier, then that would certainly be very welcome by us, and we won't complain. But we see the need to really, you know, give gradual allocation to get us properly on the roadmap to 10%. And so we have tried to propose a roadmap, and you can see it there, where we would get to hopefully around the 6.5% mark in this budget, and then gradually get up to 10% by 2030. And again, if we get there sooner, all the better, for sure. And in order really to get to the 6.5% based on the health budget figures, we would certainly need to have at least the additional 200 million that we referenced in terms of our call. So I also thought it would be useful to just you know, point to some of the figures on why investment in mental health is important. Obviously, you know, anyone on this call, I'm sure, is well aware of this information, but over 40% of the population in Ireland experience mental health difficulties. And in fact, we've seen that, you know, other studies and such have put this figure quite a bit higher. We've also seen that there's an ever increasing demand for services, and there's significant barriers to accessing timely and adequate care. We're also seeing a change in population demographics and an expected increase in our population as well in the coming years, which again is likely to further stretch services, and insufficient supports for priority groups. I think hopefully Kerry will give us will speak to that a bit more. But those groups who experience elevated risks and also experience unique access barriers when it comes to mental health care. We also currently have fragmented service delivery and ever increasing pressure on the voluntary and community sector as they try to fill gaps that currently exist in services. We also have mental health legislation reform on the horizon, which you know, I'll speak to a little bit later as well. And we have insufficient data. We don't really have a national data system, which is so urgently needed, because without that, you know, service provision is flying a little bit blind. So it's very badly needed in terms of oversight and evaluation and finding gaps. And ultimately, as we've already referenced a number of times, there has been decades of chronic underinvestment in mental health, and that really needs to be turned around for all of our sakes. So just one of the things that we do in terms of our pre-budget campaign, we survey our members and also the public to get a feel for what their asks are for the budget. And in terms of what our members surveys, I just included some information on our members survey here. And as you can see, the key priorities for our members included securing multi-annual funding for the community and voluntary sector, investing in staff in and out of hours, better service integration, and also funding advocacy. And one of the comments that we saw various versions of many times in terms of additional comments was, again, that need to get to the 10% or above by 2030. And then just to give you a snapshot of some of what the public are saying in terms of budget 2026, we put out the public survey, and as you can see, we got 134 responses from members of the public. And what was great to see is we got a really wide range in terms of the people that filled out the survey. So we had people with direct experience in mental health services. We had people that are supporting those accessing care. We had those working directly in mental health services. And then we also had those working in research, policy and advocacy. So a really nice mix of respondents. And one of the questions that we asked people was what they think is working well with mental health services. And as you can see there, the answers were, everyone was able to fill out whatever they thought themselves. So we have grouped them, but as you can see, the top answer was really about specific initiatives, specific approaches. So things like trauma-informed care, things like recovery colleges, peer support. I know Solace Cafes came up a bit as well. I think that might be touched on later as well. And then we also saw commitment of mental health staff. A number of comments recognized the resourcing and the staffing challenges that they face, but that many people wanted to recognize the hard work being done by mental health staff, which was really nice to see. It was quite concerning that we had a relatively significant number of people, say very little or nothing in terms of the progress that they felt was being made. So that is concerning. Just it is a relatively significant figure. So it's something we need to be looking at, reaching those people, that they get the supports that they deserve. And then others spoke about the quality of services once they're accessed, but noted that there are access challenges, which certainly was a theme throughout. And finally, the fifth most common would have been the voluntary and community sector and their role in filling gaps. And then in terms of what people thought were the biggest challenges in terms of mental health services, the top one was staffing issues, and probably linked in quite strongly with that is also under-resourcing. We also saw a significant number of people talk about the inadequate out-of-hours crisis care and how, emergency departments are not fit for purpose and do not give people the dignity that they deserve. We also saw people talk about long waiting lists and access barriers, again, geographical barriers. So both of those really fall under access, and we certainly linked them together in our pre-budget submission. And finally, the fifth most common would have been the unavailability of alternative therapies. And so probably most relevant to this presentation, we asked the respondents about what the top priorities of the government should be in terms of investment in mental health services in Budget 2026. And as you can see there, a very significant number of people spoke about out of hours mental health care, the need to have alternative crisis care pathways. So that was really something that stood out strongly. And then waiting list reduction came a close second, with recruitment staff and alternative therapies and funding for the voluntary and community sector then following on behind that. So those were the kind of key priorities identified by the public. And so we took all of that information, and it certainly was a lot between all the different surveys, between everything. We tried to break it down into kind of a few key sections of our PBS, because otherwise it would have been hundreds of pages if we hadn't tried to do that. So basically, we broke it into 5 buckets: invest in access, invest in communities, invest in sharing the vision, invest in youth mental health, and invest in legislative reform. And I'm going to touch briefly on each of those points now. So in terms of improve access, we are requesting that an additional at least at least 25 million go into that. And what we're asking for under that, or what we're flagging under that category, are things like the need for that funding to address the really long waiting list that we're seeing in some services, particularly primary care and CAMHS, is something that was repeatedly mentioned. Also the need to, again, upgrade emergency departments and resource alternative crisis care pathways. So, you know, ideally people don't end up having to go to the emergency departments at all, but should they do so, you know, that it is more appropriate than it currently is for them. As I referenced earlier, the absolute need, and it falls really strongly under access, is the need to create a mental health data system. Without that, you know, as I said before, it's very difficult to actually make sure that things are allocated the correct way, and that, you know, services are filling the gaps that they need to. We also need to see targeted funding to close the rural-urban gap. And linked in with that, the ongoing HSE regionalisation efforts, which, you know, are about improving access, you know, must be backed by transparent budgeting, and also, very importantly, ring-fenced funding for mental health. And finally, as part of the access, you know, funding needs to also go into meaningfully integrating the voluntary and community sector, because they are really key. A key way that many access services currently, especially underserved communities and priority groups. And I just included a quick snapshot there below of some of the survey responses that we got. I'm not going to read them all out for you, and they are also in the PBS campaign, or sorry, in the actual PBS itself. But as you can see there, they speak to those issues really strongly, about how there's a postcode lottery in place. That was certainly something that was mentioned a few times. The waiting lists are inhumane, is what one person said. And, you know, another individual spoke about how there's just not dignity in the A&E department for someone who's in an acute crisis. To move on to communities. So we believe additional investment is needed in that, or in this area, in order to really invest in early intervention and prevention services. And the voluntary and community sector do a huge amount on that front already, but really this investment is urgently needed. And obviously, intuitively, it makes sense that this investment makes a huge difference for people, because, you know, if an issue can be resolved early, that's obviously makes a massive difference for the person, but also economically, you know, it has been repeatedly proven that early intervention and prevention saves a lot of money as well. So there's two strands to that. As part of the funding request as well for communities, we believe that there urgently needs to be multi-annual sustainable funding for the voluntary and community sector, again recognising their role in providing these services, and also increased investment in supporting the mental health needs of the priority groups. And again, you can see some of the comments below, such as, you know, prevention is better than cure, and early access is key. It could prevent deaths. To move on to our third area, we also spoke about the need for investment in advancing Sharing the Vision. And under that, we also spoke about, so while the Sharing the Vision implementation plan for 2025 to 2027 was recently published, and we certainly welcome that, and there's a lot of great stuff in there. Unfortunately, what was missing is information around costs and staffing levels, and we think that information is critical to actually making sure that the implementation happens. So we would like to see that cost and information provided. Obviously, as well, the funding needs to go to the outstanding and the upcoming Sharing the Vision milestones, and to expand an investment in specialised services and clinical programmes. Those, you know, have there's been significant investment in those in the last couple of years, and, you know, the feedback has been really positive on those programs. So it's really important. And I suppose just to very quickly touch on one of the outstanding Sharing the Vision milestones that we want to particularly flag would be the lack of a national mother and baby unit, which we believe is so urgently needed for mothers who, you know, are trying to access acute care, and currently are being separated from their infants, which is not appropriate. And finally, under Advancing Sharing the Vision, funding is absolutely necessary as well, in terms of capital infrastructure. So that's something that the government have been talking about doing, and we certainly welcome that talk, because it's urgently needed that the infrastructure gets improved. And again, you can see a quote there about the absolute need for follow through on these kind of policies and plans, because otherwise they're just words. But hopefully now, with this funding, they can become a reality. In terms of resource and mental health, that was our next key pillar, I guess. And I mean, we've seen multiple reports in recent years about really, the crisis that is the youth mental health services, the fact that there is, ever increase in demand, and very long waiting lists, really across all levels of child and youth mental health care. So we believe targeted funding is urgently needed for all of those, at all of those levels, be it early intervention prevention, be it primary care, or be it crisis or CAMHS. We also wanted to see funding allocated for the Children and Young People's Mental Health project. So that's now in its second phase, and that's really about helping to build a more coordinated, integrated, and modern youth mental health system, and really leverage the voluntary and community sector. And in order to do that, really the funding needs to be in place, we would say. We also wanted to see resourcing of the Child and Youth Mental Health Office. This has been a really, major step towards integrated care, and building on it built on sharing the vision, and it outlines 16 key operational priorities to deliver. And one example of that would be a single point of access, which would be obviously amazing to see. So in order for that to happen, though, that really needs to be funded. And we certainly hope that happens. And again, some survey responses that you can see there is about the waiting lists and prescription, and a real need for an overhaul of the services. And then finally, in terms of fund and legislative change, as I briefly alluded to earlier, the mental health bill is currently working its way through the legislative process, and is expected to come before the Seanad later on this autumn. And we believe that funding needs to be allocated for that now, really, because many of the updates on that will take some time to scale. So an example would be, based on the current draft, is the expanded role and remit of the Mental Health Commission, who, based on the current version of the bill, will have a significantly expanded role in terms of oversight of CAMHS and oversight of community care, and that will need to be funded and scaled. And similarly, the increased role of authorised officers as well. Another key area under that is the need for the establishment of a statutory right to independent advocacy. That is not currently in the mental health bill, but it's something that Mental Health Reform have repeatedly called for, and will continue to repeatedly call for, because we believe it's urgent that is provided for, in line with many neighbouring countries who already have that right. And we believe, under that umbrella, that there is urgent need for investment in national independent advocacy services for mental health service users at all ages and at all levels of service. And that brings me on to, I guess, really just a summation of all of our key points, or our key messages. Really what we wanted to say is that mental health funding must be treated as a national priority. There have been decades of underinvestment, and that needs to change, and we need to get ourselves firmly on the path to 10% of the overall health budget by 2030. We also wanted to see that promises made, such as those promises in Sharing the Vision, which is a really progressive policy, and many of our other policies as well, that those promises actually become a reality. And in order for that to be the case, funding is urgently needed. And finally, we really want, and we need, a mental health service that is timely, accessible, and equitable for all, that looks at providing early intervention, community-based supports, specialist care, and crisis intervention, and leverages really the role of the voluntary and community sector as well there. And then I suppose I just want to briefly touch on as well, that while the focus of this presentation today is very much largely on the need for increased funding in mental health services, and I hope I've made it very clear to you on why that is urgently needed. Mental health difficulties do intersect with many other issues, and those are the responsibility of many other government departments. So spanning areas such as housing, addiction services, social protection, disability supports, and it's actually something that we discuss more in our 2026 pre-budget submission to the Department of Social Protection. But it is really something that is urgently needed, that there is a coordinated strategy across government departments in terms of dealing with the intersectionality of mental health with all those other issues. And I would just note on that it was great to see that Minister Butler signed the declaration on mental health in all policies with the WHO on behalf of Ireland, which really speaks to the need for integration of mental health consideration in all government policies. And I'm going to hand it over now, but I suppose I just want to finish up by saying that really, as this marks the first budget of the new government, it really is a chance for them to take a bold and decisive step forward in terms of making sure that decisive action has been made to put us firmly on that pathway that we badly need to be on to deliver a mental health service that we really all deserve. Ultimately, investing in mental health saves not only money, it also saves lives. And with that, I'm going to hand over to Louise for the panel discussions, which I'm looking forward to.
Thanks so much, Lisa Marie, for that whistle-stop tour through our very comprehensive PBS PBS. And yes, it's been very difficult indeed to get everything that we want to say into the actual submission itself, and then to communicate it here today and to give it justice to the seriousness of the situation that we find ourselves in. But I'm absolutely delighted to have Kerry and Emma and Julia on the panel today, all coming from kind of different perspectives. So we'll try and get a nice overview of thoughts. But I'm going to start with Emma, who, as Stephen said, is a mental health advocate and writer, and a really serious campaigner, particularly within the space for crisis healthcare, crisis mental health interventions, particularly in the space of solace cafes and alternative crisis pathways. So I'm going to start with a warm-up question.
Okay.
So, so how has your experience with mental health services shaped your view of what needs to change?
Okay, so I suppose when I accessed the services here, it was back 22, 23. And I suppose this is what you do when you're in a very, very bad way. You go to A&E. And it is probably, to be quite honest with you, the last place that you do want to end up. I don't want to say, you shouldn't go there if you have, self-harm. There's lots, there is people that need to be there, but to be quite honest with you, it's not the right place. It's also, just going into the A&E environment in general, it should be separated. You have massively, you could be waiting 12, 14 hours to be seen, and they're just not able, you know what you mean, in that space. I suppose, and every single person that goes in is very individual and has their own needs and their own, their own thing going on. And I mean, it also, I don't think you can be supported there, really, to be quite honest with you. I mean, also straight out, to be admitted there, I don't know how sick you actually have to be quite honest. And my experience was in Tallaght Hospital. And I mean, across Ireland now, back in 2005, we had a population of over 4 million, and you had, you had basically 4,000 acute beds. Today, you have a population of 5.38 million, and you've got 1,100 beds. So, it's quite huge. So basically, bear, 100,000 people, you've got 20 beds. So that's kind of to start off. And I suppose when I went in there, they're very, very busy. They do obviously want to help, but you're waiting and waiting. And the truth is you're going back out again and you're going back to primary care. And that is how it is, which is not good enough. And it's not okay for people because you've over 50,000, 51,000 people, accessing services, going to A&E as a first timer, every year. And this is what they're going into. And this is wrong, this is really wrong. So, yeah.
100%. Thanks for that, Emma. And you're dead right. There was recent research came out to say that there were 51,000 presentations in emergency departments last year.
Yeah.
And these are presentations into a really clinical environment, people who are sick, people on trolleys, no dedicated space. And it's an absolutely inappropriate environment. And maybe you'll talk to us now a little bit about those alternative crisis pathways that you've worked so hard in the past to kind of advocate for. So you've been a strong advocate for the need for alternative care, crisis care pathways. So can you tell us some more about why you feel they're so important and what those pathways look like now and what they could look like with with real investment in the future?
Yeah, I mean, look, I think these are small steps as well. But for example, the Solace Cafe, when I read quite a bit about that and I researched it, I just think this is such a great, great resource and service for your community. I've campaigned for a long time now, for one in Dublin Midwest, which is serving a huge area. So, you're serving Tallaght Hospital, which has a catchment area of over 400,000 people. You're serving, James's, you have Blanchardstown. And this is, they have been rolled out. There is one, I think, due to be rolled out and opened up in Limerick. There's one just recently opened up in Sligo. I just, I really feel I can't understand why it's not happening or why it can't be implemented more quickly or what's going on. And I mean, I'm not saying, because I actually deal with a lady working in the HSE and we've been working on this together, and it is a battle, and it's wanted, and it's just at the moment I can say that I did a proposal myself and it was put forward there within the HSE, and we will know more in November about where it stands for Dublin Midwest. But a little bit about.
Could you tell people, sorry, Emma, just to cut in,
sorry.
Could you tell people what is the Solace Cafe?
Yeah,
Because we know, but if you could,
yeah.
if you could give an outline of what it is, just so people know what we're talking about.
Yeah, no, it's a non-clinical environment, but it's an out of hours service. So when someone is in distress or they are having, a crisis, this is a place to go, and it's peer-to-peer, support. Now there are different models, and you have to, it has to align with, from learning a lot more about it, but the way it is, I mean, for a lot of people, it's where they can go, sit down, have that conversation, get directed to, I suppose other available services. And I mean, I just say as well, it's not just for someone in a crisis. Anyone can go there who is in the need of it. I know when I spoke to someone in the Cork cafe, a lot of people are coming there because of loneliness, no conversation in the day or contact. And I think to go in and have that sort of safe, calm space, have a cup of tea, sit down and have that chat and be helped in that way. Because I think a big thing for people as well is just to kind of know that someone's there and they're listening and they feel like they're being helped, you know, in some way, being directed. You know, you're in an environment at A&E, it's you know what I mean, the priorities is just very, very different. So, and I'm not saying that's perfect. I mean, I think at the moment a lot of them, it's a Thursday to Sunday, they're opening kind of between 5 and 11, but I just think it's really great for people to know that that's there. And if
Mhm.
they, you know, that they can go there and be helped, you know, with peer-to-peer support, you know?
And there's some really interesting research actually came out last
Yeah.
week from the University of Limerick, and they did a review
Mm.
to see what the impact of these solace cafes you know is, because there's no point in having these services without an evaluation and
Yeah.
finding out, you know, what do people actually feel about them, how useful do people feel that they are, and what is the impact that they're then having on
Mm.
acute you know, acute places of care like emergency departments. And I think what they found was that it did reduce emergency department presentations, and it also, you know, people spoke about how it really alleviated um social isolation, like what you're saying there, that people were
Yeah.
going, you know, and that feed, it's not just a crisis piece, that feeds into early intervention as well. If people have
Yes.
somewhere to go, then they're not becoming more isolated and more distressed because they have this outlet.
Yeah.
um but that's great. So thank you so much for for giving the overview, and we'll come back. We'll come back to you a bit later. I'm going to just jump over to Kerry, um, and um, Kerry is from Exchange House, and is doing great work with, you know, marginalized groups, with the traveling community. So could you tell us a bit more about the work Exchange House does, and from your perspective, what role the community and voluntary sector plays in supporting mental health in Ireland, particularly for those who may fall through the cracks of those formal services?
Sure. Thanks very much. And I hope I can speak to this appropriately after Emma's really excellent input and the presentation that Lisa Marie did. I suppose Exchange House Ireland, for anyone who doesn't know, is a traveller specific service. We provide frontline services to the most marginalised travellers in the country. It has been around, as Stephen said, since 1980, so quite a while. And I suppose it services across the lifespan. So we'll work with children to adults. So we provide after school projects, we have youth services, we have education and training services. We are lucky to be in a position where we are QQI approved, so we can provide QQI approved training to people who use our services. We have family support services, addiction counselling, crisis intervention services, and then also our national mental health service, which is one of the main reasons that I'm here speaking to you today. So I suppose again, it's services across the lifespan, but it's also services that ideally provide what people need in the way they need it, when they need it, and how they need it, with genuinely as little to no barriers as possible to accessing those services. And I suppose that really for anyone who contacts us at all, whether they be from the traveller community or not, we will very often work very well, actually a lot of the time, with lots of other service providers from mainstream and other community and voluntary services to work together to provide culturally appropriate services to the traveller community. But much of the time, people who come to us because they cannot access services that they need to access anywhere else. And from the broad spectrum of services I've mentioned there that we provide, those services have built over the years in response to people who come to us seeking help and support, and the services have been built around the needs of the community. So I suppose that's kind of one of the premises of the organisation. And the other piece, which again I'm just privileged to be in the organisation and to be able to work in this way, it's an organisation that has both travellers and non-travellers working together to provide those services. So everybody in our service, all of our services on all of our teams will have a mix of travellers and non-travellers who are providing the services. We operate, I suppose, for our mental health service specifically, we operate on probably what people will be familiar with in the primary care context, or the typical HSE or HSE mental health service context. So we operate a multidisciplinary approach. So really it's around ensuring that people can receive the mental health support they need whether it be on the mental well-being or mental health promotion side of things, right up to and including severe mental illness and suicide and suicidal ideation and self-harm, etc. So we really do try and provide what people need, how and when they need it. We provide outreach services, detached youth work. We have a duty service, which means that anyone can contact us any day of the week by phone or by email, either self-referral, family or friends, the wider community, or indeed other services. We will always endeavour to help ourselves, or if not, we will work with others to provide the solution. And I suppose that's maybe where the piece around the community and voluntary sector comes in. I suppose one of the pieces that I think is so important about the community and voluntary sector is the ability of everyone in the sector to be flexible, to be responsive, and also to work in an integrated fashion with each other, but also with mainstream services. And I suppose the key thing that I would love everyone to take away from today is, and in terms of the requirement to actually act on investment in mental health, is to ensure that it is integrated, and that mental health, as Lisa Marie said, is much wider than specialist mental health services, because really ideally less than 10% of any population should be needing to access specialist mental health services. Really, mental health is much broader than that and includes social determinants of mental health and social determinants of health. So by addressing education, you are addressing mental health and mental well-being. By addressing access to employment, you are addressing mental health and mental well-being. By addressing and investing in early years education and access to education for young people and young people's mental health and well-being, you are addressing mental health and down the line mental distress and potentially mental illness, and also suicide prevention. So all of the services we provide really come back to that social determinants of mental health approach, and really ensuring that, I suppose, what we do and how we provide the services are very much informed by the community who receives the services. And I think that's another piece that I will ask everyone to take away from today is, when we talk about having diverse and culturally appropriate services, very often we then need to move to having diverse and culturally diverse workforces, because ultimately, until our society is actually structurally diverse, and until people have and see diversity really across the entire workforce, from frontline right up to leadership positions, that is how and that is when culture changes, and that is how and that is when services and service provision changes truly and really. It's when structure is actually diverse.
That's great. Thanks so much, Kerry, for that.
Jump in whenever you want me to stop also, by the way.
No, not at all. You're like, you can see the passion there. You get going, and yeah, it's brilliant. No, it's great to see. And it's what you're highlighting there is all of the services that Exchange House provides. Money has to come from somewhere to give to ensure that they're there. And it's really important that the government really it sees the seriousness and how important it is for people to have access to those services, especially people from minority groups, because of the barriers that they face. We want to make services as accessible as possible, and you can't do that on a shoestring. Thanks so much for the overview and the response. It's brilliant. I'm just going to, because I'm conscious of time, because we want to get onto the floor for some questions. But I'm just going to swap over to our resident child and youth expert, Julia, and ask you to come in on the children and youth piece. So over 8,800 children are currently waiting more than 2 years for psychological support, some up to 13 years, as we've seen recently in the media. So how do you break this cycle of inhumane waiting lists? And what would a properly resourced early intervention system look like from your expert opinion?
Thanks, Louisa. And hi, everyone. Thank you so much for being here today with us. And that's actually a really important question, because what we're talking about here at this point is not just in efficiency, it's in humanity. Like we know the numbers, like by May of this year, over 4,400 children were waiting to be seen by CAMHSA, which is a 15% increase on last year, and the referrals are also climbing, and that is simply unacceptable in 2025. Like the impact of these delays is devastating, and without timely support, difficulty escalate, and families are then pushed into expensive private care, or they're left with no help at all, and young people often deteriorate until they require specialist CAMHS intervention, only to face another long waiting list then. And this cycle compounds the stress, increases the pressure on services, and costs the state even more in the long run. And the evidence that we have now is really overwhelming. Our mental health system is under severe strain. We're seeing more young people presenting with complex needs. Difficulties are emerging earlier in childhood, and demand is rising sharply. At the same time, there is a lack of early intervention pathways. CAMHS is stretched far beyond its capacity, and we have several reports from UNICEF, the Children's Alliance, and the national surveys, and they all point in the same direction, which is the youth mental health in Ireland is getting worse, not better, and that the state is falling behind. So how do we break the cycle? Asked Louise. So first, we need urgent and sustained investment, and that's why we are calling for an additional 25 million in budget 2026 to expand early intervention and community-based supports to strengthen staffing and build a system that is accessible, sustainable, and responsive to the real needs of children and young people in Ireland. And then how would a properly resourced early intervention system look like? It would do three things. So first off, it would expand community and school-based services, reaching young people where they are before problems escalate. And we all know, and my other colleagues have talked about this earlier, like voluntary and community organizations already provide a wide spectrum of evidence-based supports, from peer-led programs to low-intensity therapies. And these services are trusted by young people. So with multi-annual funding, this capacity can be scaled quickly, easing pressure on CAMHS and reaching thousands more children every year. And then second, it would build true integration between statutory and voluntary services. So the Children and Young People's Mental Health Project has already shown how collaboration between the HSE and the voluntary sector can actually strengthen capacity and reduce gaps in care. So that kind of partnership, co-designed with young people and their families, needs to become the norm and not the exception. 3, it would create a 3-tier system. So early support services, both statutory and community-based, for children and young people with mild to moderate mental health needs, specialist camps for those with moderate to severe mental health needs, and then clinical programs for those with more complex or co-occurring needs. So this layered approach would ensure that no child falls through the cracks and that each young person gets the right care at the right time. And then breaking the cycle requires collaboration and commitment. So there is no single organization that can do this or solve this alone, but together, so statutory services, voluntary providers, policymakers, and communities, we can all build a system together that doesn't leave children waiting years for help, but instead delivers timely, compassionate, and effective support.
Thank you so much, Julia. That's great. And I think it's, it's something we see in the news all the time. It really is. It's almost a measure of our society, how we look after the people who are the most vulnerable, and people sitting on waiting lists, not just children, anybody sitting on a waiting list. They're sitting there getting worse. There's no active waiting techniques, and they really need to be targeted. But I know we've got lots of questions coming in on the Q&A. So I'm going to hand over to Stephen, and we'll go there. Thanks, Emil.
Thank you. Thanks very much, Louise. It's been great to sit back, and I just want to say well done to Lisa Marie and the team on producing the presentation and the report, and for all the contributions to the panel discussion. We can go through the questions now. I did post in a link to our Budget 2026 website, which has the full document, and then also a very easy breezy 2-page summary as well for those who need a quick look. So if anything has come up for you as well, please use the opportunity to let us know in the questions. So we have 2 from Stephen. So Stephen Shield has asked, how can members get involved in sharing the PBS to their networks? Well, I can speak to that maybe as we're wrapping up, because I can forward on links as well to be the best way for you to reach out in your own personal capacity, or if you're working for a member organization, there's plenty of ways to use your voice. Your second question, as mentioned in the PBS, secure housing is the cornerstone of mental health recovery for people. How can we convey to elected reps the importance of recovery in the community, and also the importance of increased funding to community services? So thank you very much to that. Yeah, housing is the cornerstone of security and stability. I wonder, I might put that out to the panel. How can we stress the importance of this community services investment?
I could speak briefly to that, just in terms of just general remarks in terms of the importance of reminding people that mental health cuts through every part of life, full stop. So in terms of social determinants of health and social determinants of mental health, is reminding people. And even if one is speaking to elected representatives who really are thinking of votes and of budgets and of bottom lines, if people are mentally well and if people feel secure and if people have a place they can call home, or they know they have somewhere they can go, that means people are more likely to be socially connected, psychologically safe, and connected to people and places, and are more likely to contribute and be able to contribute to society in many different ways. So investing in housing, investing in education, investing in all of the things that don't necessarily say explicitly mental health, directly contributes to good mental health, to good psychological health, and to social connectedness. And as one of the, I think, the EU country with the highest levels of loneliness, I think that should be something that concerns us all. If you want to address loneliness, having somewhere that you actually can come back to on a consistent basis and call your home, as opposed to call your accommodation or your house or your abode, but somewhere that you can actually say, I feel safe and at home here, that will contribute to decreasing loneliness and increasing mental well-being.
Thanks very much, Kerry. And I think that speaks directly to the Solace Cafes as well. Emma, you look like you want to chime in.
I just was going to say very quickly, as well. I think, it has to be pointed out with this that recruitment is probably one of the biggest issues here, is to get and to get staff working in certain facilities, and that, that's a huge issue. And it was pointed out at the Joint Committee Health Debate by Dr. Matthew Sadler, that you can, to fill certain positions as well, and to have people come in and work there. I mean, personally myself, I think the Solace Cafe is an amazing space for people to go and help, but some people need a lot more as well. And I mean, for example, day clinics, I think, is a really important piece that should be developed. But to get behind that and do that, and I mean, I'm speaking from my experience as well, because when I got sick in Germany, I was in hospital for a period of time, but I would say the day clinic was where I really got myself back on track, and got, it takes a really long time, and that's the thing as well with mental health. It's you have to look after it, and it's constant. It's there, it doesn't just, it's not like a physical illness, it doesn't just go away, it's a long time, and people need a lot of support around that. So I think just to mention that. Sorry. Okay.
Thank you very much. Louise had contributed something here, another Louise O'Leary. I wonder if these might be relevant advocacy tool reference points to focus on highlighting the significance of housing and other issues concerning mental health. And she's provided a link there to the Department of Health. So thank you very much. Yeah, appreciate that. And day clinics, I'm not sure, would people be completely aware of that experience that you had in Germany, Emma? What a day clinic involves?
Sorry, I mean, so the day clinic was, it's kind of part of the hospital, but I have to say as well, this is it's a hospital which is just for, it's a mental health hospital, so it's not, it's not a general hospital, and this was connected to it. And I just think their structure, their plan, their day it's very well managed, and you feel you have that space, you can be in it for quite a period of time. I don't think we do not have anything on that scale here, except maybe in possibly St. Patrick's Hospital, but that's private. for a lot of people as well. And you have to raise that too. I mean, we have a lot, we have nearly 50% of people don't have private health insurance. And it is hard to access those services then, So something similar like that, within the primary care, but then you also need to get people to come in and work there. And particularly, I think down the country, in other areas, to actually have the staff to support this service for people in the community, is also up for major discussion. And I just think mental health in general is not a political urgency at all, and it has to become one. I think maybe that's a little bit harsh in some respects. I do think Minister Butler is, there is a lot going on, and there has been a 31 million investment there, but a lot more needs to be done for people in this country. It's just not good enough at all,
Thanks very much, Emma. Yeah, I think we can commend on some of the strides that the minister has been able to take, but where's the fire under the belly for that urgency as well? And I can definitely I can feel that. So thank you very much, and I thank you to all the panel speakers. I'm just looking at the clock. We can be winding down. So is this an opportunity for any final thoughts or maybe questions from our participants? Quick fire questions.
Oh, sorry.
Yes, Julia?
No, I
Go
just
ahead.
had a final thought on social housing, and I was thinking that we need to understand that we have a systemic issue, and not just in Ireland. I'm not from Ireland. We have the same thing in Italy. It's everywhere. We can't hope to help people with their mental health difficulties if we don't look also at social housing, poverty, and equal opportunities for education. Because those people that come to ask for help, then they go back into the same environment. So, it's just like a cycle. And to break the cycle, we need help on different sides of the system. I am a psychologist, and I was thinking, what if I have a child that is getting abused, and then he goes back into the house where his father is beating him. And it's the same thing with the people that we see every day, they go back into their houses and they don't have money to pay for their food. They're gonna be back. So, we need really a systemic revolution in order to address all these difficulties.
Yeah. And I imagine that's really where it calls in for that all of government buy-in into mental health, affecting all social and commercial determinants as well. So it's definitely a fight that we have on our hands. So thank you, Julia. Thank you, and thank you all. I just like to close out the session by saying thank you very much to everybody who's been able to attend the webinar. I've included the links to the website where you'll be able to read the document in full. And I guess for me, I hope you can agree from listening to the testimonials shared today, and speaking from the heart, can really change minds, and it brings an immediacy to this. It's not just about facts and figures. And I'd love for you to take that urgency and immediacy with you as well. So to Stephen's point earlier, how can you help? This is all great and all, but what do I do now? You can go to our mental health reform website where we signposted ways for you to contact your local representative, be your TD or your senator, put pen to paper, put words to an email, and convey really what is important for you in your constituency, in your life. Because the more that we raise our voices, the more chance that we have to be heard. And before I close out, just very quickly, I would be remiss not to remind people that you can subscribe to our newsletter, which brings on a monthly basis all the direct and honest work that we're doing in advocacy and in other areas. For our mental health reform members who have attended today, thank you very much. I'll be in contact in the coming days about inviting you to sign a letter to the Taoiseach regarding Budget 2026. So it's more than just a piece of paper. It's a symbolic show of solidarity. So those details will be communicated with you in the coming days. So with that, remember together that we can help try and make Ireland get the best mental health for its people. And thank you for being here today. And thank you for standing with us. So bang on time in the afternoon. Thank you very much, everybody. Appreciate it. Thank you all.
Thanks,
Okay.
Dee.
Thank you. Bye-bye.